Hello. Well, my name is Corey Franks, and I'm going to talk to you a little bit today about psychiatric advance directives. Today, I'll be presenting you some information. We will be covering the following topics. What are psychiatric advance directives, or PADs? The development of psychiatric advance directives, outcomes produced by the use of psychiatric advance directives, and some of the challenges to universal implementation of PADs. All right, well, first off, let's look at what a psychiatric advance directive, or PAD, is and what purpose it serves for people living with mental illness. Um, Psychiatric advance directives are very similar to any other directive to physicians as a document that outlines what treatments and therapies the patient desires in the event that the patient is unable to advocate for themselves, like in the case of a mental health crisis. PADs are important because during a mental health crisis, the patient may become altered to the point where they cannot express their wishes or participate in their care. This places the patient's autonomy at risk. Patients with severe mental illness or those patients whose therapy is not well established may be subjected to incarceration, loss of their civil rights, or receive treatments that are against their personal beliefs. Due to the nature of mental illness, it is important to document a patient's treatment preferences for the care team. During periods of acute illness, if the patient becomes incapacitated, this document offers both clarity for the providers and protects the patient's autonomy. The development of PADs was a result of a growing need to have safeguards available to protect patients' rights during a time of rapid advancements in medical treatment. In the 60s and the 70s, medical advances offered treatment for illnesses that even a few years earlier seemed impossible. During this time, we see the introduction of living wills, durable power of attorney, and advanced directives for medical treatment to protect patients from receiving care that they may find objectionable. In 1989, Cruzan versus the Missouri Department of Health was the first right to die case ever decided. Nancy Cruzan was in a persistent vegetative state, and her family was not allowed to withdraw her from life support. The landmark decision established a patient's right to refuse treatment even if it results in their death. Soon after, Congress passed the Patient Self-Determination Act of 1991. This sets rules for providers to review with their patient their rights to refuse treatment and mandated processes to be in place to document any advance directive desired by the patient. These events set a path for the advance directives to include the care of mental illness and provide legal precedent that protects the patient's rights to choose how they are cared for, and especially when they are unable to advocate for themselves. Some of the outcomes realized through the use of PADs highlight the importance of including the patient in the development of their care plan and how honoring patients' choices produces improved outcomes. By honoring the patient's choice and protecting a patient's autonomy, providers can enjoy the benefit of a patient engaged in their care. And this often results in better compliance with therapy and increased consistency on the part of the patient. By establishing the patient's preferred treatment options and having those options available for review by the providers, again, during the event of an acute event, the chances of the patient receiving forced or coerced treatment are greatly reduced. Having assurances that the patient's wishes will be honored improves the overall therapeutic relationship with the care team, and this has been shown to increase patients' adherence to therapy plans and resulting long term in fewer crisis events. For patients living with mental illness, the thought of losing control of oneself and having their choices made by others is a real fear. Having trust in their care team and the tools to ensure that their voice is heard is a necessity for this vulnerable patient population. As with most great ideas, there are often challenges, and this is true concerning the widespread application of psychiatric advance directives. Here are some of the common barriers currently being faced. The role of the mental health professional in promoting the use of PADs is not well defined. Many patients are unaware of this option, that this option is available to them until they've endured several negative experiences with their care. Another barrier is the lack of consistent application and enforcement of the laws supporting PADs. Some states, the medical provider can still override or flatly ignore the directives under specific conditions. Psychiatric Advance Directives allow for those patients living with mental health illness to evaluate their treatment options during a time of good health and clarity and choose the right options for them and make certain that those choices will be honored if they are unable to advocate for themselves. There is the information for you about advanced directives for psychiatric patients. The resources and the references are included in the poster. Thank you.